in-depth interview with Kaiser healthcare workers during strike.
Outside the Zion Medical Center in San Diego. Wale.
Kimberly, the workers and strikers are gone for the day. About 20 minutes ago, they left. Sidewalks empty now. They were hot. They were tired. They were hungry. They've been here, some of them, since 6 o'clock in the morning. We are told that at one point, there were more than 600 workers at this picket line. The majority of the thousands of striking workers are here in California. And as we all know, our city also has one of the highest cost of living in the entire country. I was chatting with the strikers out here today, asking how bad things are. They tell me some of their workers don't even make enough money to live in the communities they work in, and some even have to sleep in their cars. Not to make you choose over what you deserve, but if Kaiser comes to the table and says you have to choose between staffing or better pay, is there one that takes priority over the other?
They're all tied together. I'm at the bargaining table, staffing, outsourcing, and of course in negotiations, wages are always one of the priorities. It's a full package. We need both because the workers that are here cannot sustain. They cannot sustain, come here every day, work 16-hour shifts, they're burned out, living in their cars, many of the workers, and so it's a package for us. This isn't just about the wages, this is about the patients. This is about taking care of the workers who are taking care of those patients.
And to emphasize on her behalf, we're in the healthcare field, and you have to remember that one of these days, one of your guys' family members is going to end up here. Who's going to take care of them? Who's going to give them the atmosphere that we provide, that we're caring, the compassion? Do you want someone just that doesn't have a talent for this? People that are here are standing here because they have a talent, they have a knack for this job. And then some of them, it's not a job, it's a career. We move up from here. And we were once essential, and we don't even break 100K. We were essential, we were heroes, and now they're dumping us like trash and leaving us crumbs to live on.
Give us an idea for people who are not in healthcare, for the lay person, to know the struggle that you guys face day in, day out. I know you've mentioned people who are living on the cars can't even live in the communities they serve, but from the staffing point of view, trying to deal with patients, trying to deal with the day-to-day, can you guys provide some insight, some stories of what it feels like running around in there and not having the appropriate staffing?
My part in the inpatient transport, I take you to and from your designated appointments. A lot of times we deal with a lot of patients that are combative. Sometimes we deal with facility infrastructure issues. And in some places, CNAs get abused. They get hit. We just had a recent CNA get popped in the mouth by a patient that was not themselves. We deal with a lot of stress that comes from the public. They come from a situation that they're in, and then they take it out on us. We've been abused, we've been hit, we've been traumatized with a lot of the stuff that's going on here that you guys don't see when they come here. Like I said, we take care of you at your worst, and we do our best to keep a smile at the same time.
They say no negotiation meetings happened today, but Kaiser says they will be resuming soon. Tomorrow will be the last day of this 3-day strike. Union officials tell us they would get back to us with the plan moving forward if an agreement is not reached. ABC 10 News will continue following the negotiations once they resume, and will keep you updated if a deal is reached. Kimberly.